Presentation by the Director of Emergency Management regarding the status of the COVID-19 outbreak. Chief, go ahead.
Department of Emergency Management. Good morning, Commissioner Scott Lewis, Director of Emergency Management. For the record, I begin my report today with a current snapshot. There are 29 confirmed cases in Nye County. There have been reported that there were 32. However, 3 have come back inconclusive and retesting will be required. Therefore, we have reduced the number to reflect 29 confirmed cases. There remain 0 deaths. However, we have 2 of our citizens are currently on ventilators in Las Vegas-based hospitals. 2 have recovered. That list we expect to grow very quickly within the next probably 24 hours after the completion of a process to clear individuals who have been tested positive historically but have been asymptomatic for a period of time, that they will be identified and they will be removed from the list pending any additional symptomology that they may exhibit. Thus far in Nye County, we've completed approximately 632 tests. The testing continues with confirmed contacts, COVID contacts, and or people who are symptomatic. We do not have dates set for this week yet, but we are working on that as we speak. In Nevada, there's just under 4,000 confirmed cases that resulted in approximately 163 deaths. Those numbers evolve hourly. It's a continual process, and they're doing a much better job of getting the information distributed. As part of our response, the most effective precaution, as Commissioner Koenig stated early in the meeting, is to remain with social distancing. It remains the most proven preventative model out there. With warmer weather, we are also observing more movement away from homes. We are not referring to the simply getting outdoors and getting some sunshine. We're starting to see more pedestrian and vehicle traffic away from their neighborhoods, more bicyclists, motorcycles, and we're seeing the larger gatherings at grocery stores and box stores, things along those lines. So we're still urging everyone to use extreme caution. The prevention models outlined by our governor remain in service. So mask up, PPE, social distancing. We also have identified the availability of the information on NyeCounty.net. Remains very important to most of our communities. People are tagging on to those messages on a regular basis. And to remind you that in the event that you don't have internet access, the COVID hotline remains 775-751-4333, and the prompts are offered in both English and Spanish. Under resources, we're holding steady with personal protective equipment, also known as PPE. Our burn rate is in alignment with our access to equipment and supplies. The state has reversed a previous stance where medical providers historically have had a separate supply chain going through their private vendors. They are now asking the county DEMs to stand back up and also to have all the resource requests funneled through DEM through a potential acquisition through state and federal resource chains. So we are currently rechanging our models back to our original in compliance. We had previously identified surge facilities and other related equipment, but we have not had to open or implement the respective plans. We are still prepared to do so in the event it becomes necessary. We continue to compare contract tracing on all confirmed COVID cases and developing the matrices necessary to identify and understand the overlapping risks. That is very, very important not only to our citizens but also to our community government and the county governments. So we're working diligently on maintaining those identification and those risk factors. We continue to bolster our back pocket list. As you may recall, that is a contingency plan and list of appropriate vendors for both supplies and services. Also, just to further expand on that, also the majority of those have already been vetted by the state government, so it gives more credibility to the availability of those resources. We have identified mental and emotional health support through cooperation with Nye County's Nye Community Coalition, and the coalition can be contacted directly at 775-727-9970. Under our recovery plan, we are closely monitoring the federal and potential state models for reopening our economy. The federal plan considers a tiered approach which allows governors to open their states using the federal model or something similar or even more robust. As everyone is closely monitoring, Georgia is opening their economy. The scientists and many others are extremely concerned about their method in which they're doing it, but again, it's going to be the template for what happens across the country. The Leadership Task Force team and the department heads continue to develop the viable and sustainable incremental return to work plans. As you can have heard, through some of the other managers' comments today, there's been a few hiccups. That will continue to occur because, as we've talked about over and over, this is a marathon and not a sprint. We're going to see peaks and valleys, and this is going to be with us. Our normal is going to be an anomaly, and so we are going to continue to face these challenges for the foreseeable future. But having the necessary plans and the contingencies in place is what's going to lead us to success. We ask that you stay connected with loved ones and make certain that your family and friends are safe.